Okay, hi everyone. This is Chris. This is my second attempt at uploading a professional nursing video. It sounds like everyone's had some technical difficulties, and I did too. So I'm reposting now. So hopefully I can kind of capture what I put before. I just got off of 4 shifts in a row. It's pretty hard one today, so I'm pretty tired. But so the first question, reflect on trends in nursing and elaborate on those that you think will have the greatest impact on your future nursing career. Um, there was kind of three that I thought about with this. One of them is the one I think we've all seen a little bit too much of, which I think there's a bit of a trend in nursing on much higher expectations on nurses in terms of patient load, skills performed, the things that they need to be doing in a shift, much higher expectations on charting, on how much data is being collected, on how things are tracked. And I think that's going to have a really great impact on future nurses, kind of in two possible ways. I think it'll keep going the way it's going, which I feel, and I think many people feel, is pretty unsustainable for the career. And I think a lot of nurses are going to quit. And I think that's going to keep happening until the system can't handle it anymore. And then hopefully, I think there's going to be some change to both bring nurses back, make working conditions a little bit more doable for nurses, because right now I think in a lot of ways they're not. Another thing kind of in that vein that I think is a trend is it seems to me, and I feel like this is what I've seen, is that nurses are increasingly expected to do more technical and advanced skills. Technology is more involved in care than ever. Nurses are taking the lead on a lot of these things in the patient care setting, are doing a lot more skills than I think they used to do. And again, I think that can be really cool and really awesome, but also it could come at a cost depending on how it's rolled out, whether or not that's being sacrificed in terms of time with the patient, care, those kind of soft skills that make nursing kind of special. But also there's some really awesome, cool new stuff. And then the third trend I've been kind of seeing or hoping to see is a continued focus on prevention, on upstream interventions for healthcare, on viewing really every interaction with the healthcare system, whether it is from your primary care doctor, but all the way down into inpatient acute setting, being an opportunity to intervene in the things that determine people's health, and really just have like a more primary care prevention focus on healthcare. That's just what we have to do to have a successful healthcare system, I think. That's what countries that have seen health disparities, have seen some of the chronic illnesses of like modernity actually start to be chipped away at. Those countries are putting much more focus on primary healthcare. And I think that we have just really lagged behind this country. And of course, we do amazing things in the hospital setting. And like most new nurses, that's probably where we'll start. But I do hope that the trend of understanding that we can't just treat people for what they're in the hospital for, but we need to help prevent them from coming back and just living better lives. So yeah, I hope that trend does continue, and I hope to be part of helping that trend. In terms of values and ethics within nursing, I chose to look at some of these trends through the code of ethics to try to kind of think about how they align or don't align with the values that we've set forward as a profession. And I think the first two provisions can kind of really speak to what's going on with the trends in increased patient care loads. So provision 1, the nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. And then provision 2, the nurse's primary commitment is to the patient, whoever that patient is, whether it's family, community, etc. And I think that some of the trends in really increasing the workload of nurses is forcing us to sacrifice on those provisions. I've seen nurses in our clinical settings have to do things that I don't agree with, and do things that I think really put patients at risk sometimes. And I can't blame them in a lot of ways, because I think the system is set up to fail. And so that's kind of a trend. Also, Provision 8 talks about the nurse collaborating with other health professionals and the public to protect human rights, promote health diplomacy, and reduce health disparities. I think that actually speaks to both of the other trends I talked to. So, in terms of the collaboration piece, nurses are playing a really important role in the healthcare team in the hospital setting, and they're doing more and more skilled uh, skills, techniques, like I discussed, and that's being done in kind of in a professional, collaborative way. I also think that Provision 8 speaks to the role of nurses in terms of being part of helping to address the like larger systemic things that are affecting people's health in our country, and helping to, I don't know, look at those, address those in each and every healthcare setting they work in, whether it is in the primary care setting or in the hospital setting. And just the responsibility that we have. And again, that kind of plays into that ethical piece of it. And overall, I think in terms of legality, I think about how places where there's more of a focus on workers' rights in terms of like nurses and nurses being unionized. I think they tend to have better working conditions, and I think that also tends to translate to really good patient outcomes. And so that's something else, just on like a side note, that I really hope to be part of, is helping to advocate for better working conditions for nurses, because I think that this career and the framework of nursing and the philosophy of nursing can be really, really powerful. And I think in a little bit of, in some ways, some of the clinical experiences in nursing school have shown me that I think that we're being squandered as a resource. And I hope to be part of helping to kind of open that up and use us more effectively and also more innovatively, because there's a lot more to healing than the way our system has treated it for a long time. Anyway, that sounds like a kind of a dark ending. Like I said, I had a pretty hard shift, but I'm really excited to be almost done with nursing school. I'm excited to be a nurse, and I'm grateful for everyone who helped me along the way. Thanks.